The question about are there certain subsets of people that benefit and others that don't benefit from the ketogenic diet with relation to brain tumors, I think there will be someday some tests that will tell us who's going to respond better and who will not respond as well, and that'll have to do with the nutritional genomics. I believe that when we really understand patients' underlying metabolic disorders or genetic deficiencies or genetic aberrations or differences, that we will find a subset of people that either developed a glioma in the first place because of their metabolic underlying problems and their genetics, or who are more likely to benefit from it. But as a rule, I really don't think there's anybody who shouldn't try it who has a glioma. I have found that essentially every patient that I place on the diet has had some form of an improvement in their follow-up, and since I've been exposed to this and really more aware of it, I find a certain, at least, observation. It's anecdotal, it's just my observations, and I haven't tabulated them or formulated true data on it, but I see a large number of my patients who seem to have the same triad of metabolic syndrome and type 2 diabetes and problems that kind of leads to their glioma formation, although it's not by any means 100%. I certainly have skinny people with glioblastoma. I have, but when we change them, when people really start adhering to the diet and start noticing a health benefit with healthy weight loss, with better clarity of thought, with decreased inflammation in their brain on their scans and follow-up, and also decrease in enhancing nodules and decrease in progression and recurrence rates and actual shrinkage of tumors on follow-up MRI scans, that gets me very excited. So I don't see any reason not to try it for any patient that has a glioma. My passion now is about trying to decrease toxicity so that if we actually win the battle for patients with glioblastoma, that we preserve a quality of life, not just a quantity of life, that we're understanding the underlying basic mechanism of maybe why their glioblastoma started in the first place and counteracting that with a holistic dietary, ketogenic diet approach, and that has very many protective effects of anti-inflammation, helps decrease the toxicity of our radiation treatments that I still think are almost always necessary for the highest grade tumors, but still maybe at a lower dose, at a lower toxicity rate, and really looking at this, not treating the whole brain in a toxic way, but in a non-toxic way, and helping that quality of life to be maintained as well as the quantity that they get.